As we all know that the bones form the framework of the foot, whereas the muscles and the ligaments, they help in the movement occurring at the foot. So let's get to know them. Let's discuss talus bone first. So the talus bone has no muscular attachments. For stability, ligaments do attach to it in various directions. So if we see, the anterior talofibular ligament and the posterior talofibular ligament, along with the calcaneofibular ligament, provide stability to the ankle joint from the lateral side. On the medial side, the talus bone is held by a massive ligament named deltoid ligament. So as I've told you about the huge size of the deltoid ligament, let's discuss its parts. So first we have the tibio-navicular ligament that is attached to the medial malleolus of tibia to the navicular bone. Then tibio-calcaneal ligament that attaches medial malleolus of tibia to the calcaneus bone. Afterwards we have tibio-talar ligament that attaches to the medial malleolus of tibia and connects it to the talus bone. So altogether they make up the huge deltoid ligament, as you can see here. We have a mnemonic to memorize them as well, which is alive people carry too many thoughts to dance, where A stands for the anterior talofibular ligament, P stands for the posterior talofibular ligament, C for the calcaneofibular ligament, then comes T for the tibio-navicular ligament, then the tibio-calcaneal ligament, and T for the tibio-talar ligament. In the end, T stands for the deltoid ligament. The next bone we have is the calcaneus. The calcaneal sulcus is the attachment site for the interosseous muscle, talocalcaneal, and the cervical ligaments. If we talk about the plantar surface of the sustentaculum talli, it has a groove formed by the tendon of flexor hallucis longus which provide attachment to the deep part of the flexor retinaculum. Distal to the posterior talar facet, a non-articular area is present on the calcaneus bone. It provides the attachment for the extensor digitorum brevis, main band of the inferior extensor retinaculum. If you look at the medial process of the calcaneal tuberosity, there is a prominent medial margin to which flexor retinaculum is attached. And focusing on the lateral process, abductor digiti minimi is present there. Abductor hallucis and flexor digitorum brevis muscles are also present there. The medial margin of the sustentaculum talli provides attachment for the plantar calcaneo-navicular ligament and short and long plantar ligaments. On the margin of the sustentaculum talli, we can find the attachment site for the tendons of the flexor digitorum longus. Large medial head of the flexor accessorius is attached distal to the groove for the flexor hallucis longus. The plantaris muscle is attached just near to the calcaneal tendon. Now we will discuss the muscular attachments of the navicular bone. The navicular bone has a navicular tuberosity to which the tibialis posterior muscle is attached. The dorsal surface of the navicular bone attaches to the neck of the talus with the help of a broad and thin dorsal talonavicular ligament. Moving to the lateral side of the navicular bone, we can find the plantar and dorsal cuboidonavicular ligaments and the cuneo-navicular ligaments that joins the bone to the three cuneiform bones. The plantar calcaneo-navicular ligament is attached near the proximal aspect of this bone. Now you can memorize all these ligaments by the fact that this navicular bone has 3 cats and 2 tigers. Here, the 3 C's stands for the cuneo-navicular ligament, cuboidonavicular ligament, calcaneo-navicular ligament, and 2 T's stands for the tibialis posterior muscle and the talonavicular ligament. Now we will move towards the cuboid bone. So the medial surface of the cuboid bone provides the attachment of strong interosseous ligaments. These ligaments attaches the cuboid bone to the cuneiform bone present alongside. So in the end, we will discuss the muscle attachments of the three cuneiform bones. So first, we have the fibularis longus muscle and the tibialis anterior muscle that is going to be attached on the medial cuneiform bone, whereas the tibialis posterior muscle attaches on the lateral side of the intermediate cuneiform and the lateral cuneiform. Flexor hallucis brevis muscle attaches the cuboid bone to the lateral cuneiform bone, which is present on the plantar surface of the foot. You can memorize it by a mnemonic, which is 4 to the floor, where F stands for the fibularis longus muscle, T for the tibialis anterior muscle, again we have T for the tibialis posterior muscle, and F for the flexor hallucis brevis muscle. So this was all about the tarsal bones. I hope you have understood each and every detail about these bones. So to get to know more, keep watching sqadia.com.